pleased to have you today. So, Antoine PAPIERNIK from Sofinnova. I'll let you present Sofinnova in a few minutes. And we are very happy to also to have Lina NIKOLOPOULOS from the eHealth Forum and Dr. Vasilis APOSTOLOPOULOS from the Athens medical group. The European ecosystem in innovation is very dynamic, strong and mature, but we must be careful to stay successful in health. We also need to create a real bridge between innovation and health. So what are the topics of attention for you? Donc, Antoine, perhaps I just give you a few minutes to present yourself.
Sure, thank you. So Sofinnova is a venture capital firm based out of Paris with offices in London and Milan as well, but we have a large team of people, 60 people across the whole European region. 18 nationalities in our firm, and we are specialists of life sciences, and that's healthcare for the large part, but also what we call biotech for sustainability, which is a growing part of what we are interested in. And 2.5 billion euros under management across all the value chain of venture capital, from very early stage company creation, incubation, to the later stages before IPO or even public investments.
Thank you. And when we have prepared this panel, you told me that we were we have a lot of chance to work in Europe with technology. We have all the good ingredients to succeed, but we had to be careful not to shoot yourself in the foot with sometimes the regulation. So what do you mean by that?
Yeah, I think I was referring to medical device because Europe has been a really important bed of innovation for medical device because we have amazing clinicians, you know, from Greece to France to Italy, amazing clinicians. And in medical device, the inventions come from the physicians. They come from them operating on patients. And the regulation has changed 10 years ago to implement something called the MDR, the new regulation, which I think is making it incredibly cumbersome for anyone to develop products for the benefit of European patients. So it would be odd, I would say, if we're not careful, that all these fantastic innovation ultimately serves to US patients, because that's exactly what people are doing. So we need to make sure we open our eyes and make sure we adapt the situation to ultimately serve European patients, if it's a European invention. That was, I think, what I was referring to.
Thank you. Vasilis, when preparing this panel, we were talking about the dependency from foreign countries, and particularly from the US. But just before answering my question, I'll let you present yourself and your group, please.
Well, thank you very much for the invitation. It's a great pleasure to be here with you today. I very much believe in the strengthening of the cooperation, the intra-European cooperation in general, but specifically the Greek-French cooperation. I think that we are similar in a lot of ways, and I think that this event today can help accelerate this dynamic. I'm Vasilis Apostolopoulos. I'm the Chief Executive Officer of the Athens Medical Group. We are one of the largest healthcare groups in Southeastern Europe. We own and operate hospitals in Greece, but we also have a subsidiary which operates diagnostic centers in Romania.
How dependent we are from foreign country, and you are from foreign country, and particularly US. How do you manage with it?
Well, I think that the pandemic revealed how dependent we are, not only from the US, which in any case is a friendly country, but nobody can guarantee that transportation efficiency will always be present. And of course, there are countries that as the supply chain was disrupted many times, for instance, China, this was a great problem, even for simple medical disposables, the masks that we were wearing. We experienced a huge shortage of this kind of consumables. So from the simple medical consumables to the more, let's say, complicated medical devices like the refrigerator, we need to reconsider and take the decision, I mean, at a pan-European level, not only on the basis of prices, but also on the basis of availability. So to my opinion, it's worth paying a premium for a European-produced either a consumable or equipment, but on the other hand, make sure that you will not be dependent or experience huge shortages that will be beyond your control to tackle.
Thank you. Lina, just a few minutes to present yourself.
Thank you very much for being here. It was about 10 years ago that we created a network of people, companies, research organizations that are interested in the digital transformation of health. It was when the electronic prescribing was introduced in Greece, and the hope that, you know, a huge business around data and precise medicine and personalized solutions would be built. So what we really wanted at the time is to provide the networking and the collaboration between individuals, but also organizations, to just collaborate, mature their ideas, and do business. So it was really a network that came out of a need to just for a new business that it was going to be created. Good. And you know that IoT, the Internet of Things business, is going to be a huge one, and it will to transform health. And that's how, you know, this was created.
Good. And finally, for you, crisis, pandemic, it's a big opportunity. And so why? And what to do to seize this opportunity?
Well, actually, I think the pandemic really indicated how important this digital transformation is. And people would hear telemonitoring and telehealth and would say, no, it's not for me. But you know, over the last 2 years, this became a reality. People adopted it really easily. Of course, you know, the digital literacy through the social media, etc., helped. But also, you know how it is to just talk to your doctor over the phone, and if you have, you know, this Fitbit things, that he can always monitor you. So people were accustomed. Of course, we have issues like data. You know, open data is not always available. And, but I think that pandemic showed that we will go a lot faster. And innovation is not only, you know, in creating new drugs or new vaccines, but it's also introducing innovative ways of doing things.
Thank you. Now we have to finance companies to innovate. We also have to work on the support and visibility to be in a long-term vision. So Antoine, you finance and support health tech companies. Which record do you have for that? Finance longer, on a longer time, or?
I'm not sure I understood the question, whether...
Which is, in fact, which record do you have when you finance
which
and you
role?
support? Yes, which recommendation?
Well, yeah, I mean, we start company very early on, so often there is a scientist and, you know, one member of the team. So we're really quite equipped to start early on. In fact, we have a dedicated team that are also entrepreneurs within Sofinnova that actually take on the position, the CEO position or CTO positions, helping the inventors basically get their company off the ground. So we can even start with the entrepreneurs at that time. Then, of course, we structure our intervention. We compose board of directors of those companies. We bring people with experience, talents that have been entrepreneurs themselves, successful entrepreneurs, or people from our world, the big pharma or the big biotech. So bringing along co-board members that are really competent in helping those young entrepreneurs get quicker to the right level. And then I would say a big part of our work, because we work in syndicate, is to help find other investors, like-minded investors, who will then take the company to the next stage. So finding those, syndicating investors is a big role that we play for the entrepreneurs. Finally, the last part, which is also quite critical, is ultimately we need to exit. So that is either through the public markets or through acquisitions by big pharma, big medtech. And we are, in a way, a sort of a business development agent over our companies. And we have 70 or 80 companies in the portfolio, so we basically preach, to all the corporates what our companies do, and then ultimately they can do partnerships or ultimately acquire the company.
And you told me that we have to think to finance companies on a longer time and also to go faster.
Yeah, I think we've gone a long way, and we have a lot more money than we used to, but the road ahead is still quite long, and it would be great to be able to continue the road and make sure that those companies are. It's great that when they are bought for billions, but maybe they could be turning into tens of billions or hundreds of billions in value, and for that we need more funds, and we need to be able to sustain their operations as long as it needed, basically, until they become self-standing businesses.
Yes. Vasily, do you believe in the bridges with the innovated and startup ecosystem, and are you taking in initiatives in that direction?
Absolutely, yes. I think that as healthcare is spearheading the fourth industrial revolution, I think that the words healthcare and innovation are becoming synonyms. So I think it is also our duty as operators in a large scale in the country to be involved with innovation and local efforts for innovation. And I will just give you, I think, 3 examples. One example is called PD Neurology, which is a startup that actually was conceived by a team that used to be part of my group. So they declared their independence, to put it that way, and I gave them my blessing, and I'm also holding a minority let's say, stake in this venture. So they are trying to develop a medical device for Parkinson's disease. This is one example that we support. And then to give you just another couple of examples that are related, other than my capacity as CEO of the Athens Medical Group, I'm also chairman of the Hellenic Entrepreneurs Association. So 2 of my members and friends there, in the period of pandemic, we were discussing, as we had a lot of free time, especially in the beginning, how we can, be smart and innovate in this period. So one of the companies is called Vitex. They are providing painting colors. So the idea they came up with was to prepare a formula that will embed in the color so that whatever you paint, it kills coronavirus. So we participated in this program. We were their test field, and together we co-developed this color, which was a pan-European success. It was the first kind of this color to be certified at the European level. Obviously, we gained the benefits because we painted our hospitals with that, but we were extremely pleased that we participated, a Greek company presents something innovative. And then the other example, again, another member of our association who is active in robotics. They came up again with an idea if they can produce an autonomous robotic system that would disinfect surgical theaters and other critical areas. So we helped again, and we became the test field for that, and he developed this product, which again received all the certifications, and we are proud that we helped. So I think it's something that we will be seeing more of it in the future, but as healthcare is becoming an ecosystem, and more in the future, I think that all these angles somehow should be more formally related, and how innovation can be, let's say, built in solid foundation and solid relationship between the various, let's say, participants of the ecosystem.
Thank you. And Lina, you, of course, you're fond of digital, and how do you think digital can help? Just effectively on support and visibility, to work on the support and visibility to be in a long-term vision.
You know, in Greece we have very high-profile human capital. You know, many scientists, many people with PhDs, and for very many years those people would look only outside, you know, just to go somewhere else to do either research or even business. So this changes, because now in a unified Europe, and with events like this, and with visibility, networking, those platforms that really provide visibility, these people feel that there is hope here, and that they can be ambitious here, and they can get the funding, and they can team up with other intelligent and ambitious people to do things. So over the last 10 years, I see this thing changing a lot. Also the pandemic, you know, changed that. Because people being abroad, but, you know, having, you know, their heart at home, would just look back and say, can I go home? What can I do there? And I think this is changing, and I'm really very, you know, very glad to feel that way, because, you know, when I came back from abroad many years back after my PhD, there wasn't much I could do, you know. Now people can be part of networks, can participate in big projects, research projects can become business projects, and there are these public-private partnerships that people can be nurtured, grow, mature, be funded, and be part, you know, of you know, ambitious projects. I think that what you do, visibility, networking, and nurturing will just provide good results.
Thank you. Now we're going to talk about the talents. Also, we have to find. And Vasily, you told me that of course this industry requires continual investment in technology, R&D, upscaling, reskilling of personnel. So how do you deal with this challenge?
Well, investing actually in cutting-edge technology is embedded in our DNA, and this is how we perceive that we should differentiate ourselves from the competition. However, and to come back a bit to your earlier question, this investment refers mainly to US innovation. For instance, we do hold a very special relationship with a company called Intuitive, which is producing the famous Da Vinci robotic surgery system. So actually we are a test field for this robotic system, and we are also a training center, one of the 3 in Europe, etc., etc. But we would like to see some European companies taking, the leadership in this field. Maybe in the beginning as a co-production model, so that some transfer of know-how can come, and then try to start developing autonomous European innovative systems. I think that this is something that we should all put our effort on. We also cooperate a lot. It's our preferred technology partner, GE, and of course GE has a solid, European base as well in France. So I think that we should all place our efforts, even the policymakers in the European level, provide the right motivations in such multinational companies to establish European factories and European production facilities.
Okay, and you, thank you. And you, Antoine, how do you deal with the challenge of finding right talents for your companies?
So before I answer this, I'm going to tell
Yes.
Vasilis that we have a perfect company for you. It's actually a French company called Moon Surgical, and you should check it out. Ex-Intuitive Surgical, ex-Oris Robotics, etc. So check it up. You'll see. It's not competitive to Intuitive, but it's a wonderful company. And one of my partners is actually the CEO of the company, Antoine. So I'll go back on you on that. So you see, we've live made some connections here.
Exactly.
So look, the talents, yeah, you need to fetch them. So you need to convince them. This morning I was talking about how much Greek talent there is out there that has, that are incredibly known in the US. Bring those talents back. I mean, tell these people they need to contribute to their country, and that if we do this in every European country, we're going to get an inflow of high competent people that are going to. And they don't have to necessarily all come back, but they need to contribute. You can stay in the US or wherever you are, and you contribute to your country. And I think if we get those talents, I think that's going to accelerate our growth. Of course, doing it from the ground up and making sure that entrepreneurs, have experience, then you back them again, and then you back them again. That's the natural way, but it takes time. Here, it's about acceleration. You need to go quicker, because the world is going quicker. And I think we need to, everyone needs to make the resource to get those talents. If you get the talents, I think the rest is easier.
And you gave me the example of Nemo when
Yes, so Paris-based company, Nemo, based out of an invention from academic scientists from the Curie Institute, one of the world's famous institute. And we put the seed, the first million basically to help this company get out of Earth, and then find the talents. So we raised a Series A, which was the largest, still is the largest Series A in Paris, of 75 million euro. We gathered, 2 US investors, one ourselves, of course, 2 US investors, 1 Asian investor, and so it's we are in a field that is global. So you need to look at every opportunity as a global opportunity. Nemo is a perfect example. It has an office in Paris with half of the personnel. The other office is in New York with half of the personnel, and that's how you build a global company.
Thank you. So, Lina, what about human resource in Greece? I think you're also happy with the quality.
In Greece we have quite a lot of talent, but now with the digital technologies, teams can be anywhere. So, for example, if you take the example about 2 years ago, there was a huge EU marathon about how to hack the COVID. And about 2,000 teams were formed, 120 of those got prizes, and they were, most of them, international. So teams, you know, you have a good idea, you just make it known, and you can attract, you know, very good talent from anywhere. Then, of course, you have to just make up those teams work, and you have to have, you know, a clear-cut business, you know, model to just grow it. But I think during these times, we can do a lot better, and I'm really confident that Greece is very well placed, you know, in Europe and in the world in terms of human capital. We're a small country, but, you know, our Agora, you know, our market is a big one. And with people like you, but also entrepreneurs, you know, very innovative and very open-minded like Vasilis, I am very confident that we can do it very well.
I'm happy to see that all you three are very, very optimistic. So what about the future of healthcare in Europe? What is the French and the European point of view? So Vasily, do you think that we go towards a European strategy to autonomy?
Well, sometimes I think that, I mean, we are healthcare providers, but sometimes I think that we are also becoming a technology company in a sense. So these two are interrelated, and I would like also to add that investing in cutting-edge technology is one thing, but on the other hand, you should also invest in attracting human talent. So in our group, especially during the past 2 years, because we invested in the technology, and maybe sometimes this investment is a prerequisite to attract the human talent, we were very successful in repatriating some top doctors of the Greek diaspora from Europe, but I should say mainly from United States. So I think this is something that we should systematically do in all aspects, not only the doctors, but also the scientists that are involved in the R&D. And Greece and France have, I think, an added benefit in this type of effort, the climate. So Greece and southern France especially can create special areas like the Silicon Valley that the scientists could live there, enjoy the sunshine, and let their brains, you know, be creative and think and innovate.
Thank you. And Lina, you have you already told me that you are waiting for improving the role of private sector. Which private sector, and why do you believe so much in private companies? And
you know, I believe in the agility and of the private sector. And I also believe, of course, in the right legal framework that the government would have to just support. But on the other hand, you know, private sector gives you room to grow. But you just have to have hope that something can be done. You have to be ambitious. And you have to feel that there are opportunities for collaborations and to make money. You know, money is not the right word, but to create value, to put it this way. And value can be very many things. I very much believe in the private sector, but I also believe that the governments should provide the legal framework and the ethics to do business.
Thank you, Lina. And Antoine, what do you think about the future? You told me that you were very happy because Europe have all the means to achieve sovereignty and to be successful. Can you explain?
Yeah, well, look, I've been in this business more than a quarter of a century, so I see the evolution. And when you look back, you have to recognize how much progress we've made. So that gives me hope that indeed, we have indeed all the ingredients, technology, talent, tons of money. So there's things that need to be done. There are still codes that we need to crack. We need to convince people how important it is to do that, to keep that value, to be global, but still keep the value in Europe. It doesn't mean autarky. It means being completely open to the rest of the world. Asia, the US are indispensable to success, but it can be done in Europe, and there's no reason not to do it.
Thank you. Perhaps the last point of view. Do you want to see something just as a conclusion? Do you want to add something, Vasilis?
I would like to add something because we talked about the private sector. So I would like to make a general comment because this pandemic revealed something that I have always believed, that private and public sector are and should be complementary. So we experienced in real life how this, this relationship evolved during the crisis, and how the private system supported the public system when it was in need. So I think that this concept should apply in all European countries. Of course, the mix between the two should be defined by market forces, because not all circumstances are the same in all the countries. And then to have the state who can, let's say, provide the framework and the rules of cooperation between the two. So we're talking about, as the challenges going ahead, the optimization of this cooperation between public and private sector. But I would also add that we need to make a similar discussion how the relationship between EU member states should cooperate in the field of healthcare and provision of medical services to their population, and how this can be optimized by sharing infrastructures and giving people more freedom to move around, of course, when this is allowed.
Thank you, Lina. Do you want to add something?
One thing is, I think data is extremely important. In health is even more important than elsewhere, because we need big data and analytics to be able to just have evidence-based policy making and evidence-based medicine. And that should be provided by, the governments. And there should be, a framework of how to use in a secure way data, and I think the data business is also huge.
Thank you. Antoine?
Well, I'll just make a comment, because I did mention in front of the Prime Minister that we would do an investment in the next 2 years in Greece, so now the race is on. So anyone who wants to help, please do so.
Thank you very much. I don't know if some of you have a question to add. No, so I think we have finished. We are not late. We have all to be at 1:30 in front of the main stage to see the last speeches. Thank you very much. Thank you.